As a parent, it can be really difficult and stressful to see your child in pain or with fever or sick and in such discomfort. What am I describing today? Hand, foot, and mouth disease. Hello, I am Dr. Lunferndi. I'm a pediatrician and founder of Generational Wellbeing. We are seeing a lot of hand, foot, and mouth disease, which is caused by a virus. So today we'll talk about what is hand, foot, and mouth disease, what to expect, and how to help your little ones through this illness. So, starting out, what is hand, foot, and mouth disease? It is a disease that is common in children less than 5 years old. It is caused by a virus and is typically more prevalent around summertime or early fall, which is why we're seeing it right now in most daycares, where almost on a daily basis, I am seeing at least a few kids with hand, foot, and mouth disease. What does this look like? So usually some kids will start out with a fever and sore throat and maybe a runny nose. That may look like, oh, maybe they have a cold, or sometimes it may present itself looking like a strep throat or something like that, especially if they have fever or sore throat. And then eventually they break out in a rash, and the rash can be on their hands, the palms of their feet, sometimes in the mouth, all the way to the back of the mouth, on their lips, the gums, around the mouth, and in the butt. And then there's some kids who don't have the rash all over. Different presentations, because this particular virus has different strains and present differently in different kids. If your kid is in daycare and is going around, chances are they may end up getting it because this virus itself is extremely contagious. Why is it so contagious? Because of how it is spread. This virus itself can be spread either through the mucus like the runny nose or the saliva. And in the daycare settings or with kids, what do? They like to mouth everything. So imagine one kid mouthing a toy and putting it down, and the next kid takes that same toy and mouths it. That's that automatic transition. Or they just cough around, cough on the toys, and they're consistently mouthing it. So it's very easy for it to be transmitted in daycare settings and even at home, where if your child was having a play date with some other kid and they're mouthing stuff, or they go out and you end up in the grocery cart and they're putting their mouth on a cart that perhaps another kid had mouthed before. So it is really easy to transmit. Another way this can be transmitted too is through the fecal oral route. So you have those kids who stick their hands in the diaper, or maybe dirty diaper that somewhere around a contaminated surface, and then you touch that contaminated surface, put your hands in the mouth, or the kid takes in the diaper and then puts their hands in the mouth and stuff like that. So it can be transmitted through those routes, and it's very easy in kids because they're touching and putting everything in their mouths. They're sharing pacifiers, they're sharing utensils and stuff like that. So very common in this age. And yes, even adults can get it, because if you listen to what I just described as the way in which it can be transmitted, that means that if your child has hand, foot, and mouth disease and they're sticking their hands in their mouth, sometimes I've seen kids who just in their way of comfort, they stick those hands in your mouth too, or take their pasties, try to stick it in their mouth too, and sometimes they try to eat behind you, or you eating or drinking behind them. So even in the household, adults can get it too. It's just adults usually get the milder forms, even though I have seen some really severe forms in adults. So you want to make sure that we're not sharing and we're doing a lot of hand washing and hand hygiene with these when it comes to hand, foot, and mouth disease. Now, if you have been diagnosed with hand, foot, and mouth disease, what do you do about it then? Because it's a viral, or it's caused by a virus, there is no antiviral to take care of it. However, the biggest thing is really staying ahead of the pain, because those rash itself, lesions and those ulcers are very painful, especially the ones in the mouth. So sometimes the kids are in so much pain that they don't want to swallow anything, including their saliva. And if they're in such a pain that they're refusing to eat or drink anything, then the most common complication is dehydration. So we want to stay ahead of the pain so that we keep our kids from getting dehydrated and then having to end up in the hospital for IV hydration, because they will not take anything oral. So mainstay of treatment then is pain management with Tylenol, ibuprofen. Of course, you don't want to give your kid younger than 6 months old ibuprofen, but for the kids who are younger than that, you do pain management with Tylenol. And then you want to encourage fluids. This is where you offer fluids frequently. This is where you offer soft foods or anything that's soft, easy to slide down, because most of these kids are not wanting to chew, and if you put anything that is hard to chew or that goes in and pokes that lesion, that may make them not even want to eat even more. So you want to make sure we're taking care of pain, and we want to make sure that we're hydrating to prevent the most common complication, which is dehydration. Now, not only the lesions in the mouth are painful, even the ones on the hands and the feet especially. So I've seen kids too who will refuse to walk. They just don't want to walk because every time they put their feet down, they're in pain. So you may have a kid who may not have the mouth lesions, but they're just refusing to walk. They want you carrying them all around. They may still be in pain. You want to make sure we're taking care of the pain. If we're taking care of it, how long does this last? And typically within a week, the symptoms resolve within a week. Now, the child is not contagious after the fever has resolved. So if you have a child who has a fever for 1 or 2 days, 24 hours after fever is resolved, they're no longer contagious, especially if they're feeling better, they're now eating, and they're well enough to start, returning to their normal baseline activity. At that point, we can say it's okay to return to daycare, and especially if there are no other open lesions and those the rashes capped over. So at that point, they are ready to go back to daycare because they're no longer contagious. Now, the caveat is that even though there's no fever, they're back to normal, rashes capped over, the virus itself can still be shed through the poop for weeks on end. So we still want to make sure we're sanitizing and we're doing a lot of hand hygiene after changing those diapers, because you can still have that transmission as it is shed in the stool for an extended period of time. So hand, foot, and mouth, yes, it's scary. Most of the cases are mild. Ahead of the pain and making sure our kids are hydrated, the kid will be well enough to return to daycare and be back to normal, usually within a week. However, if you have a kid who's refusing to eat, refusing to drink, and there's a concern about dehydration, you may want to call your pediatrician or take your baby to the emergency room. I hope you found this helpful. Gear it up to handle it if your kid is diagnosed with hand, foot, and mouth disease. As always, thank you for listening. I am Dr. Lumfrundi.